Hi, everyone. Thanks so much for that introduction. Good afternoon. I'm thrilled to present to you all today about economic and concrete supports as a core component of child and family well-being systems. I'll be talking about the intersection of family, economic insecurity, race, and child welfare involvement. And then I'll be focusing on what the research tells us about the relationship between increased access to economic and concrete family supports and reduced risk for child welfare involvement. Given the limited time together we have today, I'll be presenting an abbreviated version of a much longer slide deck and resources that are available on Chapin Hall's website, which you can access here. I'll be sharing a lot of information today. My goal is to make it as accessible as possible, and we'll have time at the end of my presentation for a Q&A, and I'll be happy to answer any questions. If things come up as I'm sharing information, please feel free to put questions or thoughts in the chat, and we'll return to them at the end of my presentation. I also understand that you'll be receiving the slides I'm presenting today after I present, so you'll be able to access all the resources and spend a little bit more time with some of the slides. All right, I want to start by providing a brief historical context to frame our conversation. So historically, child welfare has been reactive, responding to allegations of maltreatment with investigations and foster care. From the onset of child and family services in the United States, policymakers repeatedly separated programs designed to address poverty from programs designed to protect children. Child maltreatment prevention services have received less consistent funding, and economic and concrete support policies and programs have been administered as if they're unrelated to child welfare. As a result, the root causes of maltreatment have not been consistently addressed, perpetuating family separation, structural racism, and intergenerational trauma. So what do we know about the relationship between family economic insecurity, income, and child welfare involvement? Data shows us that consistently around 60% of substantiated CPS responses nationally involve neglect only. I highlight this number because we often suspect that cases involving neglect are secondary to poverty. But the research I'm going to share with you today shows us that the provision of economic and concrete family supports is associated with decreased risk for both neglect and physical abuse. So we need to look beyond these neglect numbers. We also know there's a strong relationship between family economic insecurity and child welfare involvement. As this slide shows, nearly 85% of families investigated by CPS nationwide have incomes below 200% of the federal poverty level, which in 2023 was just under $50,000 for a family of three. Although low household income has been a focus of poverty research, material hardship is common amongst American families, and research increasingly indicates that families who experience material hardship may be at particularly high risk for child welfare involvement. So what is material hardship? It's generally defined as having difficulty paying for necessities, such as housing, utilities, food, or medical care. The study on this slide looked at what happens when families who are low income experience material hardships. It found that when these families experience at least one material hardship, they're 3 times more likely to be subject to a neglect investigation and 4 times more likely to experience a physical abuse investigation. And when families experience multiple types of hardship after not having experienced any, the impact is even greater. They're 4 times more likely to experience a CPS investigation and 7 times more likely to experience a physical abuse investigation. Let's look at some of the predictors of child welfare involvement. On the left side of this slide, you'll see that the most reliable economic predictors of child welfare involvement are income loss, cumulative material hardship, and housing hardship. On the right, you can see which types of hardship are most predictive of investigated neglect reports. Things like food pantry use, difficulty paying rent, utility shutoffs, and inability to receive medical care. There's been some interesting research on the association of negative earning shocks and increased risk for child welfare involvement. So what do we mean by negative earning shocks? Generally, these are unexpected and significant reductions in income, such as job loss. In the study on this slide, it was defined as a reduction in earnings by 30% or more from one quarter to the next. This study found that for families with recently closed CPS investigations, most of whom were low income, experiencing a negative earning shock was associated with an increased risk of subsequent CPS investigation by 18% and subsequent physical abuse investigation by 26%. So this study adds to the evidence I mentioned about the impact of economic insecurity on not just neglect, but also physical abuse. This same study found, however, that the association between negative earning shocks and risk for child welfare involvement actually diminishes when those earning shocks are compensated by the receipt of public benefits. The researchers suggest that having access to sufficient public benefits when earning shocks occur effectively buffer families against the risk of child welfare involvement. And I want to point out that the buffer may be particularly strong for families with young children. In this study, they were associated with a 50% decrease in risk for physical abuse investigations when they were able to access sufficient public benefits to offset negative earning shocks. Economic insecurity is widespread in the United States, but families are often not static. They cycle in and out of poverty over time. On the right side of this slide, you'll see data shows us that families move in and out of poverty, with almost 50% of those who become poor leave poverty a year later, but more than 50% of those who previously left poverty will return to poverty within 5 years. We believe the volatility and turbulence created by entering and leaving poverty may create serious stress for parents and impact parenting. So how might economic and material hardship impact parenting and well-being? One potential pathway is the family stress model. This model proposes that economic hardship not only deprives children of critical material needs, but it also negatively impacts family dynamics. Research into behavioral economics and the psychology of poverty indicate that economic instability destabilizes families, creating stress and high cognitive loads, which then drain mental resources and can lead to increased hostility and conflict. This in turn can disrupt nurturing, responsive, and supportive parenting and place children at higher risk for child welfare involvement. I want to emphasize that while this model focuses on the family unit, it's very important to consider families within the context of their communities, cultures, policies, and systems, all of which impact their well-being. We created this visual based on the evidence I just shared to show how multiple hardships can overload families and increase their risk for child welfare involvement. You'll see as more boxes get loaded onto this truck, it starts to break down. So what happens to the family when we start to take some of the boxes off the truck bed? We'll explore what the research tells us a bit later in this presentation. This important recent analysis simulated the effects of increased household income under 3 of the anti-poverty packages that were included in the National Academy of Sciences groundbreaking report, The Roadmap to Reducing Child Poverty. You can see a description of what was included in each of those 3 packages in the box on the right. This analysis found that implementing these packages could reduce CPS investigations by up to 20% each year, depending on which package is implemented. Importantly, it found that implementation could substantially reduce racial disproportionality in CPS involvement, with up to a 29% reduction in investigations for Black children, compared to a 13% reduction for white children. Given the findings I just shared, I want to talk about economic and concrete supports as a race equity strategy. So as I just shared, research demonstrates that economic hardship puts families at increased risk for child welfare involvement. Due to past and ongoing systemic inequities, families of color are more likely to experience economic hardship, and this may contribute to their disproportionate child welfare involvement. Therefore, economic and concrete supports to stabilize families and prevent child welfare involvement may be an important mechanism to reduce racial disparities. We know that children of color are more likely to live in households with low income compared to white children. Family income, however, doesn't show us the full economic reality of families in the United States. For that, we also need to consider household wealth. So wealth is a critical resource that enables households to deal with unexpected economic shocks like job loss. When a household has few or no assets, even a minor financial setback can make it difficult to pay for basic necessities. Due to past and ongoing systemic inequities and structural racism, there's a staggering racial wealth gap in the United States that further exacerbates the consequences of economic insecurity for families of color. As the graph here shows, as of 2019, white families held 8 times more wealth than Black families and 5 times more wealth than Latinx families. In the blue box, you'll see that while Utah has a relatively small overall wealth gap, it has the 15th biggest racial wealth gap in the nation. Because families of color are more likely to face economic insecurity, this likely contributes to their disproportionate child welfare involvement. While CPS interventions are pervasive for all children in the US, you can see in the blue box that 37% of children are subject to an investigation by age 18. But CPS interventions are particularly pervasive for Black children. As this graph shows, it is estimated that over half of all Black children will be subject to a CPS intervention by the time they reach age 18. The racial disproportionality in Utah's child welfare system mirrors that of the nation. I found information in that blue box that shows that Black and Native American children in Utah are significantly overrepresented in child removals. In sum, providing more economic and concrete supports may be an opportunity to rethink the role of CPS in the lives of children and families, and in particular for families of color. So let's talk about what the evidence tells us about the relationship between economic and concrete supports and child welfare involvement. But first, what exactly do we mean by economic and concrete supports? I've listed some examples on this slide, and do want to point out that we consider economic and concrete supports very broadly to include things like cash assistance, EITC, income, employment, SNAP, housing supports, childcare, and Medicaid. So what does the evidence suggest happens when economic and concrete supports are reduced? Before I discuss the findings on this slide, I do want to talk very briefly about the sources of evidence that I'm going to be talking about today. We have to be careful about making generalized interpretations from this body of research because each of the studies that I'm going to highlight has different limitations. There are only a handful of studies I'm going to talk about that are randomized controlled trials. Those are considered the gold standard of research because they can assess the causal impact of interventions. Most of the research in our deck demonstrates associations and correlations, but not a causal impact. And this means that other factors may play a role in the result. But taken together, we think this body of research expands our understanding of what has been effective and why, and could inform potential policy shifts and new pathways. So let's turn now briefly to the studies on this slide. So based on the research we've compiled, these are the types of economic and concrete supports that, when decreased, are associated with increased risk for child welfare involvement. Studies include things like TANF benefits being reduced, lack of access to childcare and stable housing, reduced employment and income, and increased gas prices, meaning the family has less disposable income. I'm going to focus on just a few of these studies today, but you can find details on each of these studies in the deck that's available on our website. Let's start with TANF. There's quite a body of research on the relationship between decreased access to TANF benefits and increased risk for child welfare involvement. This study examined the effect of TANF policy changes and benefit restrictions on child welfare involvement. States that implemented a total benefit loss as the most severe sanction for not meeting TANF work requirements saw a 23% increase in substantiated neglect reports, a 13% increase in foster care entries due to neglect, and about a 13% increase in total foster care entries. When you look at this impact, it's important to keep in mind the first statutory goal of TANF, which is to support needy families so children can remain at home. I also want to point out that in 2021, states were holding up to $6.2 billion in federal TANF funds in reserve, which they are allowed to do. As of 2021, Utah was holding $76.6 million of its TANF funds in reserve. Throughout my presentation today, I'll be linking the research findings to concrete examples of state policy options that may reduce family child welfare involvement. One state policy option to consider is to eliminate full family sanctions. States with full family sanctions take away TANF benefits from the entire family if a parent does not meet work requirements. We've recently seen several states move away from full family sanctions. According to this map, it looks like Utah imposes full family sanctions as the initial punishment if a parent does not meet work requirements. There's also quite a bit of research on the relationship between access to childcare or lack of access to childcare and child welfare involvement. The study in the top bullet here found that for every childcare concern reported by families receiving TANF, the risk of supervisory neglect increases by 20%. Childcare concerns in this study included things like the quality of care available, the cost of care, and difficulty finding care during work hours. The study in the second bullet on this slide found that mothers entering substance use treatment who have difficulty securing childcare are 82% more likely to self-report child neglect, compared to mothers entering treatment who don't have difficulty securing childcare. It's particularly interesting to note that difficulty finding childcare was a stronger predictor of maternal neglect than almost any other factor measured in this study, including mental health and severity of drug use. Wait lists to access subsidized childcare are associated with an increase in child treatment investigations. The scale of this issue becomes clear when we see that only 14% of children who are eligible for these subsidies actually receive them. And in Utah, only 9.5% of children under age 6 who are eligible for child care assistance receive it. It's estimated that inadequate housing contributes to the risk of entering foster care excuse me, for 1 out of every 6 children involved in CPS investigations. So we know that housing stress is a significant driver of families entering the child welfare system. This slide provides an overview of the body of research on the relationship between housing stress and increased risk for child welfare involvement. You can see the specific types of housing stress that have been associated with increased risk for child welfare involvement. And that includes child maltreatment, CPS investigations, substantiations, and foster care placement. I want to point out the data in the blue box on the left side of this slide. It's estimated that families with children make up almost 1/3 of the total homeless population in the United States. In addition, 1 in 3 children who are homeless have experienced a mental health disorder by age 8. So we also need to think about housing as a mental health prevention service. So let's talk now about what the evidence suggests happens when economic and concrete supports are increased. We previously saw the family stress model, and here we have the family investment model. When families have enough resources to meet their basic needs, they can invest in services and opportunities for their children. They can access housing, childcare, and educational opportunities. Families are able to provide nurturing, responsive, and supportive parenting, which leads to improved child and family well-being and decreased risk for child welfare involvement. This is a summary of the types of economic and concrete supports that are associated with decreased risk for child welfare involvement, based on all the research we've compiled. I'll be able to share some of the key findings in each of these categories today, but again, you can find all of the research and all of the studies and the resources on our website. So let's start with tax credits. There's a growing body of evidence showing that the earned income tax credit in particular is associated with decreased risk for child welfare involvement. This recent study found that EITC and the child tax credit payments are associated with immediate reductions in state-level child maltreatment reports. It estimated that each additional $1,000 in per-child EITC and CTC tax refunds is associated with a decline in state-level child maltreatment reports of 2.3% in the week of payment and 7.7% in the 4 weeks after payment. The authors hypothesized that the larger decline in the 4 weeks after payment may be related to the length of time it takes for families to resolve debts or other financial burdens after they receive the tax credit funds. Several studies demonstrate the potential impact of a refundable state-level EITC in particular, which means that families can receive the refund even if they don't owe any taxes. The study here found that states with state-level refundable EITC, compared to those without, had 11% fewer entries into foster care, even after controlling for poverty, race, education, and unemployment. Based on this analysis, it is estimated that if states without any EITC implemented a refundable EITC, an average of 668 fewer children would enter foster care annually in each state. Here's some more research on refundable EITC. I want to highlight the study on the bottom of this slide. It analyzed data from 14 states with and 13 states without a refundable EITC. And it found that a refundable EITC averaging about $400 per year was associated with a decrease in hospital admissions for abusive head trauma for children under 2 years old, even after controlling for child poverty. Based on this research, one important state policy option to consider is establishing a refundable state-level EITC. 26 states, DC, Guam, and Puerto Rico have already done so. It looks like Utah has a state-level EITC, but it is non-refundable. Turning now to macroeconomic supports, this study found that for every $1 increase in the minimum wage, there's a 9.6% reduction in neglect reports. Establishing or increasing minimum wage is a state policy option to consider. According to this graphic, the federal minimum wage of $7.25 per hour currently applies in Utah. I want to note that a worker paid the federal minimum wage today earns 40% less than a minimum wage worker did in 1968. We previously looked at what the research suggests happens when families don't have access to childcare. Now let's look at what the research suggests happens when they do. So in this study, each additional month that mothers who are low income receive a childcare subsidy is associated with a 16% decrease in the odds of a neglect report and a 14% decrease in the odds of a physical abuse report in the following 12 months. Let's now turn to a study on housing supports. This is a study by my colleagues at Chapin Hall. It's a randomized controlled trial that assesses the causal impact of the supportive housing intervention for child welfare involved families in Connecticut who faced housing instability. Families were randomly assigned to the intervention group, and they received a housing voucher and case management services. Families in the control group received the usual services. The study found that families who received the supportive housing intervention experienced significantly fewer removals, a lower prevalence of substantiated maltreatment, and increased reunification. To address housing needs, I want to highlight Wisconsin's pilot program that provides short-term housing funds to families at risk of removal due to housing insecurity, as well as to families unable to reunify due to inadequate housing. These funds can be used for hotel costs, short-term rentals, and expenses related to finding and maintaining housing, things like security deposits, housing application fees, and utility costs. This is an older study that looked at state-level data from 1990 to 1998 to examine the impact of welfare reforms on several measures of child welfare involvement. It found that more generous welfare benefits are associated with fewer children placed into foster care. Specifically, it estimated that a 10% increase in state public benefit levels, and in this study it was still AFDC, plus the value of food stamps, for a family of 4 is predicted to reduce foster care placements by 8%. So TANF benefit amounts are determined solely by states. This map shows the maximum monthly cash benefit amounts for a single parent family with 1 child as of 2020. Currently, only 2 states have a maximum cash benefit amount that is at or greater than 50% of the federal poverty line. According to this map, it looks like Utah's cash benefit amount is around the middle compared to other states. But in the blue box, you'll see that the value of Utah's cash benefit amount has decreased by 34% from 1996 to 2022 when you adjust for inflation. I also want to note that Utah spends only about 19% of its TANF funds on cash assistance, compared to the national average of 23%, which is also very low. When you receive these slides, you can click through to the hyperlinks I've provided on this slide and learn more about how Utah spends its TANF funds. Let's turn now to SNAP. There's also quite a body of evidence on the relationship between increased access to SNAP and reduced risk for child welfare involvement. There are several studies we have in our slide deck, our longer slide deck on our website, but I'm just going to focus on this one here today. It's a very new study, and it found that states with more generous SNAP policies experience large reductions in CPS reports, fewer substantiated reports, and fewer foster care placements compared to states with less generous SNAP policies. States have considerable flexibility to establish policies that make SNAP benefits more accessible to families. And the blue box on this slide looks at those state policy options that were included in this study. So that included increasing the income limits under broad-based categorical eligibility, excluding legally obligated child support payments from total income, providing transitional SNAP benefits to families leaving TANF, and using simplified reporting options for changes in household circumstances. With the emergency SNAP allocations now over, I think we might see increased risk for food insecurity among families as they're receiving significantly lower SNAP benefits every month. Turning to family preservation programs, this study found that families with open child welfare cases who received a home-based services program that provide concrete supports are 17% less likely to experience a subsequent child maltreatment report compared to families who received the same program but without any concrete supports. An important state policy option to consider is to provide funding for concrete supports for families. Kentucky's 2022 state budget included up to $1,000 in flexible funds for families participating in their family preservation program to meet their concrete needs and prevent removal. They actually had previously provided up to $500, but they found that it was so successful in keeping families from entering the child welfare system that they increased funding to $1,000 per family. Let's now consider a population-level public health approach to prevention. Let's talk about Family Connects. It's a community-wide short-term home visiting program for families with newborns. It's short-term, only 1 to 3 home visits. It's not an expensive intervention, and it focuses on assessing family material needs and then connecting families to needed community resources. There are several randomized clinical trials of Family Connects that looked at all families with birth in select hospitals in Durham, North Carolina, over a period of time, and found that families who were randomly assigned to receive Family Connects experienced more positive maternal mental health, a 44% lower rate of CPS investigation through their time their child reached the age of 2, and 39% fewer CPS investigations through the time their child reached age 5. In that quote on the right, the authors suggest that when implemented with high quality and broad reach, a short-term home visiting program has the potential to reduce population rates of child maltreatment. This important analysis looked at state spending across a broad array of public benefit programs. I've listed them in that box on the right. This includes things like cash and in-kind assistance, housing supports, child care, refundable EITC, and Medicaid. It found that each additional $1,000 that states spend annually on public benefit programs per person living in poverty is associated with a 4% reduction in child maltreatment reports, 4% reduction in substantiations, 2% reduction in foster care placements, and 8% reduction in child fatalities due to maltreatment. These findings suggest that state investments in public benefit programs are a population-level strategy to prevent child maltreatment and child welfare involvement. I also want to point out that box on the bottom that shows the significant long-term cost savings that would happen if you implemented this additional state spending. So they found that each additional 13.3% that states invest annually in public benefit programs would save up to $153 billion due to reduced maltreatment-related costs. So based on the analysis I just shared, a state option to consider is the level and mix of state spending on public benefits per person living in poverty. This graphic shows each state's total annualized spending on public benefit programs from 2010 through 2017. I apologize that it's a bit small, but you can see that Utah, with the arrow there, spends less than the national average. So there's definitely room to increase spending on supports for families. We frequently get asked questions about how people spend unconditional cash payments. It's well established by the research that people spend their payments predominantly to meet basic needs. Things like food, rent, auto payments, education, and to pay down debt. People do not spend unconditional cash payments on alcohol and tobacco. In fact, families in Canada who receive a monthly child benefit payment significantly decreased their alcohol and tobacco spending. This supports the theory that substance use is sometimes a response to financial distress, and we may want to consider economic and concrete supports as a substance use prevention intervention. We also saw with all of the enhanced CTC payments that went out in 2021, there's a lot of research on how families spent that money, and it's included here. They spent most of that money on meeting basic needs, education, and if they were able to pay down debt. I'm going to end my presentation with resource considerations for building a child and family well-being system. So let's first consider our current system. The annual economic burden of child maltreatment is enormous in the United States. The direct and indirect cost of child maltreatment total around $80 billion each year. The direct costs are mental health care system involvement, child welfare system involvement, law enforcement costs. And those indirect costs include things like special education, juvenile delinquency, mental health, health care, adult criminal legal system involvement, lost worker productivity. So it includes kind of everything. But the economic burden to society is much larger than that. It is estimated that it costs $428 billion to society due to substantiated child maltreatment. And this is lifetime costs incurred annually. And $2 trillion is the estimated annual cost to society due to investigated child maltreatment. Although foster care remains a necessity for some children, the system overall is associated with poor long-term outcomes, and as a result yields significant negative social returns. As you can see here, one analysis found that every $1 that's spent on foster care for a child results in a negative social return of up to minus $9.55. I want us to consider this alongside the fact that an estimated 6% of all children, 15% of Native American children, and 11% of Black children spend some time in foster care by the time they reach age 18. This recently published prospective study followed a racially diverse cohort of young children for 5 decades and found that compared to children who did not experience early life adversity, those children who experienced family instability, this included changes in parents' marital status, frequent changes in residence, parent or sibling death, and foster care, were associated with a 28% higher risk for premature death. And those children who experienced poverty plus crowded housing were associated with a 41% higher risk for premature death. The authors of this study highlight that these findings underscore the importance of integrating anti-poverty programs with family-based interventions to mitigate the long-term consequences of early adversity. I'll end today with this slide on CDC's report on preventing adverse childhood experiences, or ACEs, which I'm sure you're all familiar with here. It highlights that strengthening economic supports for families, including many of the supports that I talked about today, is a multi-generation strategy that can prevent ACEs by increasing economic stability and family income, increasing maternal employment, improving parents' abilities to meet children's basic needs and obtain high quality childcare, and reducing parental stress and depression. And I provided a link to that study on this slide, so you can just click through and you can look at it. I've also provided several resources that you may find helpful at the end of my slides. I won't be going through all of them today, but I'm happy to answer any questions that come up. I'm excited to engage in a conversation with you and share any other research that you're interested in knowing about.
Thank you so much, Dr. Graywall-Coke. This was just mind-blowing for me. I mean, I think working in the field, we get it, but I don't know that we've seen it quite this well pulled together and bringing all of the strings together to help us understand the huge impact that economic and concrete support can have on protecting families. If there are any questions, please put them in the chat. I would imagine that there are, but it's hard to know where to begin. So I just basically my question has to do with how do we advance policies like this that we know are effective, that we know will have a significant impact on outcomes, but we don't quite have the political will to get there. Like, how have other states overcome that? What can we do within Utah to kind of address sort of that gap between what we know works and what we know we can get implemented within the state? I'd just love to hear your thoughts on that.
Yeah, that's a great question. And I think it really does vary based on the political will in particular jurisdictions or states. I will say that this research is comprehensive enough that I think there's something that every state can find that they want to implement. It might not be that you're going to take on redesigning your entire TANF program, but it might be that you're going to start with providing more flexible funds to families, or emergency housing supports, or rental assistance, or trying to do a better job of linking up, families at risk of child welfare involvement with childcare subsidies. So, I mean, it doesn't fully answer your question, but I do think that there is something that you can take from this research and this presentation, some state policy options that will resonate. So it's also up to the advocates to elevate this research, and as more is implemented and you hopefully have improved outcomes, it sort of leads to more will, because we can all agree that we want to prevent child welfare involvement. Like, it's a bipartisan issue. So if we want to present this as that's our goal. Let's prevent child welfare involvement. Let's prevent child maltreatment. I feel like it resonates.
Completely agree. I think that you're right, that it really is on us as prevention specialists and those working with families who are at risk. I think it's really important for us, as you mentioned, to be the ones who really do elevate these issues. And I'm really excited that the work that we're doing in the Violence and Injury Prevention Program within the Office of Health Promotion and Prevention is very much focused on these upstream approaches. We are funded through the Essentials for Childhood grant through the CDC, which provides us funding to work on these upstream approaches to child maltreatment prevention. And we're one of only 7 states that have that funding. So we're really excited about moving this forward and having the ammunition, for lack of a better word, that these studies provide really gives us a wealth of information to help make that point. And I think that's what is most powerful to me about this presentation. I think Tricia Reynolds is still on, but as you were talking about, a little bit about the flexible funding, Tricia Reynolds and I, Tricia, who used to be the CBCAP coordinator for the state and has moved on to a different position, was talking about Utah's flexible funding. And Tricia, if you're on, would you mind just mentioning what you mentioned to me in our side chat?
Yeah, I'm here. I was mentioning that our child welfare agency does have some flexible funding options for families who are involved with the child welfare system, but not yet in foster care. So if there's families that have in-home cases, they can work through their caseworker to access flexible funding for housing, emergencies, or some of those things you mentioned. And I was saying to Joey, what we need to do now is figure out how to expand those flexible funding opportunities to families who are not yet involved with the child welfare agency, because we don't ever want them there, right? So that's maybe one pathway. And then just on that note, my colleague Marion and I saw Yasmin's presentation in October, and that's how we brought her to Utah. And from that presentation, Marion's doing a pilot project with our CBCAP grantees to give them some flexible funding that they can share with their CBCAP involved families for concrete needs, these emergency fillers for when people are experiencing job losses. So we're excited to have this knowledge and this research and to be starting to try some of these things out, but there's obviously so much more to do.
Sure, absolutely. And you know, Utah has made some amazing progress just in this last legislative session. We had some ups and downs when it came to this session, but one of the big, huge takeaways was new funding through the Governor's Office on Families related to home visiting. And we're pleased to have Amy Winder-Newton here with us. Amy, do you want to take just a few minutes to talk about that funding and how we're going to be moving forward with home visiting services now that we have that funding?
Sure, I'm happy to do that. Amy Winder-Newton, I am a senior advisor to Governor Cox, and I am the director of the Office of Families, as was mentioned. So the home visiting funds that were just approved, there's two different sets of funds. One, there was almost $1 million of ongoing funding that we had approved, and that will trickle down to the existing programs and entities that we already have involved in home visiting. It'll also help with a McV match over the coming years. The second set of dollars, there's about 15 million, 10 million of that's TANF. The other 5 roughly is one-time general fund dollars. We are in the process of writing an RFP right now for a pilot program for home visiting that can help triage families and then put them in different levels of home visiting. We know some are more expensive and more extensive. And others may be lighter touches. And we recognize that different families have different needs. And so in order to serve more families, we want a group that can come in, bid or apply for the RFP and help us figure out, like, how can we use a model like that to serve more families? So keep an eye out for an RFP in the coming months. Obviously, we'll get the word out, but that's how that 15 million will be spent.
So excited about that.
Jocelyn, can I respond to your question?
Yeah, thank you. For
Nurse Family Partnership is one evidence-based home visitation model, but there are several. So yes, we're talking about what you're talking about and more.
Go ahead, Nathan.
So this is maybe a separate question though. So I don't know if there's more discussion that wants to be had about home visiting. If not, I'll go ahead and jump into this. I was reading something yesterday about Medicaid's continuous enrollment policy ending in May, and so I was just curious to know, Yasmin, if you had any insight into. We know that obviously health insurance is a big economic factor, and that can impact people's finances. But is there any research that you're familiar with that could speak to the effects of what that might have on Utah specifically, and our Medicaid insured population that might lose some of their, specifically, it seems like transient populations and things that are harder for states to find might lose their coverage, which could impact their economic health.
For sure. You know, there's a lot of research on the relationship between access to CHIP and Medicaid and child welfare involvement. I didn't include that in my presentation today, but you can find it in our larger deck on our website. And in particular, there's research linking continuity of eligibility to decreased risk for child welfare involvement. So I do think you will see an impact from the change in Medicaid eligibility. I do want to note that several states are taking very innovative approaches to their Medicaid waivers using a social determinants of health approach. And Oregon recently had their Medicaid waiver approved, which provides continuous Medicaid eligibility, I think, for all children up through age 6, or is it age 3 or 4? So it is the first in the nation to have that. So there are things to consider.
For sure. Thank you for that. There's a question from Sarah Terry in the chat, where she's asking what individual smaller agencies can do to measure their prevention work. And I don't know if this is a question for Yasmin, or if this is a question for Nathan, or if this is a question for us to explore with maybe Social Research Institute at the University of Utah, but really about how can a small agency contribute to this broader research? I mean, what are the ways that we could measure and to be able to prove or show that an approach was preventative for abuse or neglect. Love to hear your thoughts on that.
I mean, I will say that, evaluation of all of these programs is really important, because the more evidence that we have, the more likely we are to see more funding given to this. So for example, if you're providing, flex funds, some of your in-home families or some of your CBCAP grantees, trying to evaluate and partnering with a university partner to really do a rigorous evaluation, if you can kind of figure out what the impact is of that additional financial infusion and support, I think is really important to build the evidence base here. But there might be opportunities. Nathan, you'll probably know more about Utah. I mean, you also, let's not forget, you also have your Family First Prevention Services Act. You're one of the first to have your plan approved. I think you're going to be submitting an amendment soon, and there might be opportunities there to align everything.
Anything to add, Nathan, or any thoughts on that?
Yeah, I think it's complicated when you're planning evaluations. It depends on the organization and what your role is and what you're seeking to do and everything. So a general, I think, yes, we need to be tracking how things are being done. And yeah, if we can partner with others, there's lots of universities across the state that are interested in partnering in different, especially for education purposes, for students. They'd love to have projects that they can work on for evaluation. So some really great partnering opportunities that can be taken advantage of to help do that. But yeah, it takes some brainstorming at the local level to kind of understand what might be the best evaluation tools for each organization,
Well,
I think.
And I think that we can collect some of that valuable information through our contracts, through the requirements in the contracts that we have with our subgrantees. And I think we do that, but it's that's kind of a little outside of my realm, which is why I asked Nathan. But I think that's something that we need to be talking about at the state level when working with our local level grantees. How can we help them identify the effective policies, and then how to measure it and report it so that we can collect that information. It looks like, and Sarah mentions hard to measure something that doesn't happen. And you just described the difficulty in getting the buy-in from those who hold the purse strings, because it's really difficult to prove that the money was well spent when nothing ever happened. So that is really kind of the struggle when it comes to primary prevention, is that we throw this money towards an issue, and it's very difficult for them to, some individuals, to make a connection between, we spent this money, instead of cleaning up the mess further down the line, we tried to prevent the mess from happening. But since the mess didn't happen, then we don't know where the impact was, or it's more difficult to show in a concrete way. I think that's a really good point. I don't know if you have any thoughts about that, Yasmin, about measuring something that doesn't happen.
I don't. I mean, this kind of comes back to your first question about the political will, and something you might want to emphasize is there's just a tremendous amount of research on the long-term cost savings that occur when you support families, either by providing them high quality early childhood education. I shared some of the research on the cost of foster care. There's a lot of interesting research on the recently enhanced CTC and the cost savings that could come out of providing that kind of a child allowance. So sometimes for some states that really resonates. The pool's evidence I shared about the long-term cost savings if you invest more in your public benefit system is something that you can elevate, but the particular evaluations, it is very complex.
For sure. And it absolutely is, and something that as preventionists, we've always got to figure out the best way to educate and motivate when we're trying to tell them, if you do this, then we're going to see nothing, which is what we want. There's a good question here at the end, and it's actually a really good pivot point to Nathan. Nathan and I worked together on the Essentials for Childhood project. We are part of the executive committee. I'm the coordinator, and he's the data guru for the Utah Coalition for Protecting Childhood. UCPC is a statewide multidisciplinary coalition focused on primary prevention of child maltreatment. And we have a state plan. We have some really good information and some materials on strengthening economic supports. So I think we'll pivot to Nathan now and let him kind of talk about what we're doing at the state level and how that translates to the local level and what we can do to support you in advancing these efforts at the local level. Nathan.
All right, can you guys see my screen? All right, well, Joey, I'll have you share the link to this website. So here we've created, well, first I'll show you here on the right side, we have our state plan. Can you guys see yourselves as well? Or is it, you're just seeing my page? Since I'm working from one screen currently.
We see the page, what?
All right, perfect. All right,
Yep.
so on the right side here, we have our state action plan that was created by the Utah Coalition for Protecting Childhood, which has all of our strategies and everything. But we've created this new website that is still in development. That is our state plan in a virtual sense that can be clicked on, and everybody can go through our different strategies. On here, we have our ACES Learning Collaborative. So the one you're participating in today will be added here. In the coming weeks. We're going to be adding more of our data. There's some data there, links to the Utah Healthy Places Index to look at local data. You can see child poverty and things like that in your area and see how you compare to the state. We also have other resources about adverse and positive childhood experiences. But I want to click on here. So the first strategy in our state plan is strengthening economic supports for families. And the page here shows you what our approaches are and the different strategies within those approaches. So increasing the number of eligible families receiving available tax credits and child care subsidies, the work that we're doing there, and then our work to improve access and uptake of family-friendly work policies across the state. And we have links to our state partners here. So for example, the earned income tax credit is something that we've kind of been focusing on in the past. And so we have links to our partner here, Utah Tax Help, which is our VITA, Volunteer Income Tax Assistance Professionals here in Utah. They do free tax work with families making less than $57,000 a year. And they make sure that these families are getting their tax credits. They're making sure that they're doing them correctly and that they're getting their full refunds, or at least taking care of the tax burden that they have the most appropriate way possible. So again, yeah, sorry, I have things hidden here from me. So let's see. Back to here, also the University of Utah's Connect to Collect program, really great program. There's an ACES Learning Collaborative that we did a couple of years ago now with Utah Tax Help and with the University of Utah's Connect to Collect program, where they talk about the earned income tax credit and the benefits and how we can help support families. We have only 75% of eligible families in Utah or individuals in Utah accessing the credit currently. So there's a big portion of people that are not filing their taxes potentially, or when filing their taxes, they're not getting their income tax credit that they're eligible for. So Connect to Collect especially has done a lot of great work finding out that the way to connect with those people is through trusted individuals. And so they work with doctors' offices, and they go in the doctor's offices. People are waiting to meet with their doctor. They're helping them file their taxes and get that done. And so all of you who have trusted relationships with families that are potentially eligible, low-income families, you want to educate them about their income tax credit and educate them that there's Utah Tax Help and other organizations out there that can help them get their taxes done for free. And to help you do that, we have resources here. So EITC materials. For some reason, the poster isn't on here quite yet, but we have flyers and posters in Spanish and English. If you click on them, you can get the digital one that you can download. It's also got a QR code here that can take you straight to tax help. Utah, you can look at the EITC calculator that they have here, see if you're eligible for the credits, and then it helps you get signed up to go ahead and get your taxes done with Utah Tax Help if you're eligible. So we have those flyers in English and Spanish and posters in English and Spanish. If you want printed materials, there's a form here. You can click on that to get those materials sent to your office or your organization. And with family-friendly work policy stuff, we're working on a workplace toolkit with Utah Community Builders, and hopefully we'll have that in the future. But we have great data that was made available this last year, where families across the state were surveyed about what their preferences would be for family-friendly work policies. And again, we're going to work to try and create a guide for employers to try and implement some of these preferences for families and help incentivize people to work for them and to stay with them. And we're probably also looking at the data that we had didn't have a lot of good data for low-income families, and so we're going to work with some of our other partners to try and get some more data from lower-income households and make sure that we're focusing our efforts to support especially those low-income individuals that are at most risk of maltreatment and things like that. Again, this website is under development, so there's a lot of things that we hope to add here, a lot of data that I would like to add. And I think more resources that we can also connect people with. So there's taxoutreach.org as well, which is a national effort to increase uptake of the federal EITC. But other materials, we still don't have a lot of great things. And so we need to create new materials, and we need to be connected with partners like Yasmin and her group to make sure that we have good resources that we can be sharing with policymakers, with the people that we connect with to help promote these policies that we know can be beneficial to the families that are suffering across our state. Anything else that I missed there, Joey, that you want to highlight here from our?
No, I think that's great. Just kind of a look forward on these projects. We are in the process of working with the Utah Community Builders, moving forward to develop some outreach information and toolkits to employers and policymakers on the importance of family-friendly workplace policy. One of the shortcomings or just gaps in the data that we collected through our partnership with Utah Community Builders and the Kemsey Gardner Policy Institute was that we weren't really getting good measures and good survey response from blue collar positions. Most of the respondents were middle to upper middle class. And so we're wanting to do a little bit more information and data gathering on populations that the populations that Yasmin has mentioned, those who are at higher risk for child maltreatment or child welfare involvement based upon, their risk due to economic instability. And so we are working on that moving forward. Excited about that. And then another thing, we've mentioned the state earned income tax credit. As Yasmin mentioned, we do have one. The prenatal policy to three, or excuse me, the prenatal to three policy impact center indicates that having a refundable state earned income tax credit of at least 10% of the federal EITC is a model policy for families with children under, between the ages of 0 to 3 at the bare minimum. Hopefully families with, children of any age, but especially for those early years, as those early developmental years are so important to long-term health and well-being. And in Utah, we're halfway there. We the recommendation from PN3 is to have the refundable credit of at least 10%. Utah's is 15% of the federal, but we haven't quite climbed over that additional barrier to getting that to be a refundable credit. And so that's something that we're really focused on in raising awareness and educating on over the next year, is just the importance of amending that legislation to make that credit refundable for at least families of children with children under the age of 5. So that's something that we'll be working on moving forward, in addition to our federal EITC efforts, raise awareness efforts. We're going to be focusing as well on the state level. And there was one more thing that I was going to say, but it's escaped me, and I apologize for that. But yeah, we're definitely moving forward in those areas in our upcoming years. Go ahead, Nathan.
I was just going to jump in. So Amy Winter-Newton was at our steering committee meeting of the Utah Coalition for Protecting Childhood on Tuesday, and she highlighted that the refundable aspect of the Utah EITC was a part of the governor's budget. So we have some support there, and so it's just working with the legislature to make sure that we can see that change in future sessions. The other thing I wanted to highlight, though, is the Department of Workforce Services. There is all sorts of funding that's available, as I mentioned here in our approach. We want to improve the utilization of existing government supports. And one of those is childcare subsidies. There's a lot of childcare subsidies that are available. I think that we need to work with the Department of Workforce Services to see if they have other materials that we can be sharing to help educate people about those subsidies that are available, and making sure that those who are eligible are receiving those. They were expanded during the pandemic. I'm not exactly sure where they're at right now. I don't know if we have anybody from DWS on here that could speak to that, but there's probably other resources that we could be sharing with people about those subsidies that are available, and we should make sure that we include those on our website here when we have them.
Nathan, I can answer on those. With the childcare funds, are you talking about the CCDF funds that, people under a certain income level qualify for? Yeah, so they can get between $300 and $1,000 back per month in a stipend, depending on what kind of childcare they use. But I'm happy to talk to DWS and see if we can get a flyer on that.
Perfect. And they might
Fantastic.
actually have one. We can double check that.
For sure. And we were just talking about this earlier today. We know that DWS has done some research on uptake of childcare subsidies and things like that we're interested in getting a hold of, that will supplement the information that we've collected. Nathan, there is another question here from Amy, which I think is a really good one. And I'm not sure if you're the right person to answer it, or if it's or whether or not it would be someone from DCFS. But she wonders if we track family structure when we gather data. Are we looking at single parent families versus 2-parent households? And another one that we often overlook are grandparents raising grandchildren. That is becoming so much more common, and very often they're not sure which tax credits they qualify for. So I don't know, Nathan, if that's something that you can address.
Yeah, it depends on the data source, but yeah, I'm certainly the tax commission has that information. A lot of the public health surveys that we have both nationally and here in the state, we ask about family structure. And so, yeah, we do have that, the ability to look at the data in that way, and often do.
Fantastic. JC Graham asks or mentions an issue here in the chat that I think is important to point out. She mentions that a few clients have asked why they can't claim 17-year-old child on their earned income tax credit. You can't claim a child on earned income tax credit, but you can claim them on additional dependent or care credit. So I, for one, I have a 17-year-old. When my children were younger, I was able to get EIC. When, as a single divorced parent, I was able to access those funds because I was below that income limit. But you also have that option for there are additional tax credits that take the place of the earned income tax credit. for older children. And that doesn't just end at 18. If your child continues to live with you and continues to be a dependent because they're going to college or they just haven't been able to move on, housing costs, things like that, you can continue to claim that dependent past the age of 18 federally. So just something to consider, that we're not, when we talk about tax credits, we're not just talking about earned income tax. We're talking about child tax credits, additional expanded, I can't remember what it's called, the dependent care credit. So there are definitely more than just EITC. And I think it's really important to point out, Yasmin mentioned earlier that a lot of people who are eligible for EITC don't claim it. We're nationally, I think we sit at about 1 in 5 eligible people does not claim. That's the last number that I heard. But in Utah, it's 1 in 4. We're one of the worst states in the nation for EITC uptake. And it's hard for us to know, based on the difficulty in getting data from the IRS, who it is that's missing out. But some of the data that we've seen, study through Child Trends a couple of years ago, mentioned that Spanish-speaking families are very, very likely to miss out on earned income tax credit. It's one of the reasons why we provided our awareness materials in Spanish, because that is a really high-risk population for missing out on that. And then when talking with our partners at Tax Help Utah and Connect to Collect, the general agreement, even though right now it's hard to have the data to back it up, is that the people who are most likely to miss out on this credit are folks who are so low income that they're below the filing threshold. They don't have to file, so they don't. They're just not understanding the huge financial benefit that there could be for their family if they did file. And so we really need to work on that population, that population that is below the filing threshold, who doesn't quite understand that the benefits to making sure that they file. If you make $1, you qualify for the earned income tax credit. And so we really need to do a better job in getting that information out to that population.
I wanted to just talk a little bit about that, because I think what you just said is so important. There's some very innovative ways to think about if you want to focus on increasing EITC. I was just reading about an evaluation where there are home visitors that go and help really vulnerable families are going to be raising awareness about the EITC. So there are ways you can think about it, and in a broader sense, I think we really need to think about the administrative burdens we put on families to access these services and supports, and how difficult it is, especially if you don't speak English, to navigate so many different systems, so many different application forms. It can be overwhelming. When we talked about the cognitive load of being economically scarce, to think about taking one more thing on can be just too much when you're working several jobs and you have all these children, right, that you need to take care of and get food for. So we're seeing some innovative approaches, including if a family is qualified and receiving SNAP, sending them text messages, notifying them about EITC options, or people really respond over the smartphone. So just thinking about ways that you can link up and work together for all the different systems that support families and make it one application, one eligibility application, and proactively letting them know, not putting the burden on families, but thinking about how the systems can work for families. So,
for sure, and it's a really good thing that you mentioned about administrative burden. The Prenatal to 3 Policy Impact Center also mentions decreasing administrative burden as a way of improving economic stability for families. For instance, with SNAP benefits, the recommendation at the federal level is that we renew once a year, and that everything is available online to initially apply and to renew. And right now it is online. You can apply and renew online, but our requirement is every 6 months. So again, we're almost there on that policy and have a little bit more work to do in order to decrease that administrative burdens for access to SNAP. So I appreciate that you brought that up, Yasmin. Are there any other questions, comments, anything that, there are no bad questions here, and you have a wealth of knowledge and information here with Yasmin. So please, any other questions or comments or concerns? Looks like we have a couple here. JC Graham, you're correct. You cannot access the child tax credit for a child that is 17 or older, but you can get that dependent care credit. And you also, and JC also mentions that people can't afford tax advisors. Absolutely, Tax Help Utah is the answer. Our VITA these are people that are just citizens in the state of Utah who are trained by the IRS to act as a tax filer and to help folks navigate that process. They can help you do it online. You can use their portal to access digital services to file, and you can also do an in-person meeting. Those are a little bit more limited than they used to be due to COVID, and they're still trying to kind of build up those sites again. But Tax Help Utah is definitely the resource for folks who are not sure how to file, have never filed before, or are concerned about complications in their tax return. So definitely that is a fantastic resource to share with, and the information on those flyers actually takes you to Tax Help Utah, which takes you to the EITC calculator that's with taxoutreach.org. So yes, for sure, that is an important point, and that's why we're trying to raise awareness, JC. Thank you for that. Next question, are income thresholds for these programs going to increase as the cost of living in Utah has over the past 3 years? I wonder, that's a good question. And I think it's a hard one to answer. And I don't know, Amy, if you have any comments on that about income thresholds changing as cost of living increases in Utah?
I have no idea. Sorry.
So for the federal programs, I don't know what's what I'm looking for. The formula that they're using is, but they do increase from year to year. Like the earned income tax credit formula changes, or the threshold changes a little bit from year to year. So we know that because in the past we've made materials that are now out of date because the filing threshold changes, but I don't know how that formula works, whether or not cost of living is part of that, or how that is developed. Sorry, I don't know if Yasmin does.
Sorry, ask me the question one more time about income level.
Do filing or income thresholds for programs like these change based on cost of living? Camilla asks specifically about in Utah, and I think that's kind of the hard thing for us to answer. I think that it's sort of out of our hands when it really does come down to legislation. But Yasmin, do you have anything that you'd like to add to that?
I do know there's a lot that states can do in terms of setting those income eligibility thresholds within the federal kind of guidelines and restrictions, right? So, you know, some of the studies I cited show how to increase income eligibility thresholds for SNAP. So I know there's a lot of flexibility, and there's also, you can remove asset limits, which is a huge problem as well for families if you want to actually have them save any money and not be kicked off benefit programs. So I don't know exactly if some states tie like their TANF cash assistance to an annual cost of living increase, so it automatically goes up, but not many states do that. But I do know there's a lot of flexibility within your state programs to, you know, make adjustments around income levels and eligibility.
Yes, thank you for that, Yasmin. Angela asks the question, and I think this is such an excellent question, and I wish I had a good answer for it. But are there plans to increase education about these things in high schools, in high school health classes, to help them learn about these things that are going to help them be good parents in the future, like economic stability and things like that? I don't know that our health classes in Utah are that far upstream at this point, but I think it's a really good question to ask. And I don't know if there's, if you're aware of anything in other states that is focused on the younger population just coming into adulthood, because I think that there's a kind of a general consensus that sometimes some of the things that we teach our children aren't as valuable as some of these more basic and really important, just fundamental things to adulthood and successful adulthoods. So any thoughts on that, Yasmin?
I mean, it's really a general question. I'm all for kind of education and improving access. At the same time, I don't think we should only think about put the burden on families or individuals. I think we need to think about the larger systems that support families versus kind of educating parents. I think you need both.
For sure. Yeah. I think that's the exact right answer. Any other questions, concerns, or comments before we wrap up today? Trying to get better at long, uncomfortable silences. If
I'm going
there's
to jump
no-
in.
Yeah,
I'm going
go
to jump in real quick and just mention that I'm going to throw here in the chat. We'll also send it in an email afterwards, the evaluation for the event. If you have an opportunity to jump in, just a few questions, let us know what you thought, any suggestions for improvement as we continue to plan new events and bring in new guests. But yeah, thank you.
Yes, thank you for that. Now, we don't provide certificates of completion unless they're requested. So we do ask that you complete the evaluation. You're not going to be asked for a certificate, but you do need to keep track if you're going to be requesting credits for social work, mental health. That's kind of on you to keep track. And so if you need a certificate of completion for that, please reach out and I'm happy to provide that. As far as CHES and MCHES credits, please complete our evaluation, and also that is a link to the instructions on claiming the CHES and MCHES credits that I put in the chat. It says at the bottom, payment and deadline. You do not have to, gosh, my mind just went blank. Yeah, not sure what I was going to say, but please do, or that's what I was going to say, sorry. You do not, there's no payment. All you need to do is make sure you meet the deadline in completing the evaluations for the CHES and MCHES credits. If you are interested in receiving a certificate of completion, if you could please email me, I'm putting my email in the chat, and then I can prepare one and get that out to you. And then as Nathan also added into the chat, and Nathan, I received a private message from someone who had tried to use the form to order EITC materials. It said permissions were needed. So we'll make sure that both of these forms are accessible. You can be added to our mailing list. Nathan has added that link into the chat. The mailing list helps you be informed of upcoming ACES Learning Collaboratives, new other educational opportunities, and kind of keeps you on connected to what we're doing at the state level.
Yeah, sorry, the default is that only state employees can use the forms, but I fixed that. Should be accessible to everyone.
Thank you, Nathan. And also on the mailing list one, is that one open and available as well? Perfect. Yasmin, thank you so very much for presenting to us today. I think we're all just kind of blown away by the amount of information that we received. It's going to be so helpful in guiding our efforts at the state level and at the local level, I think, moving forward. Yes, it's just been amazing. As a reminder to everybody who attended, we will be adding the links to the slides as well as the recording to our website. And I will send out an email to everyone who's registered when that is up and ready to go so that you can access that information. But thank you everyone for your attendance. Thanks so much, Yasmin, for this amazing presentation. We are so appreciative of it. And we hope you all will join us next quarter for our next ACES Learning Collaborative. Stay tuned on topic and date.
Thanks so much. It was wonderful to be here.
Thanks so much. It was great to have you. Have a wonderful day, everyone. Thanks for joining us.